Hi, Dr. Dempsey. This is Pat Norman. This is my breast exam video, and this is my practice patient, Miss Brown. And Miss Brown, I'm Pat Norman. I'm going to be your student nurse today, and we're going to do a breast exam. Is that okay?
That's fine.
Okay. All right. Well, first of all, Dr. Dempsey, what I'm going to do is I'm going to inspect the breast with her sitting upright. And what I would like to do is do the concentric pattern, just working my way from the outermost portion of the breast inward to the nipples and areola nipples. Alright, so what I'm going to do is I'm going to start, Miss Brown, by starting around right up here. And I'm just going to be checking for any nodules, any masses or anything like that. And you let me know at any time if anything's tender.
Okay.
Do you have any problems with your breast? Have you had any discharge or tenderness?
No.
Okay. 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 Alright, and now, check right up in here. And what I'm doing now, Dr. Dempsey, is checking up around the tail fence, going up into the axillary area. And I just want to check her axillary area lymph nodes. Okay. Now I'm going to go medial axillary, lateral axillary, okay, anterior axillary, and posterior axillary, and I don't feel any abnormalities. Now, Miss Brown, I'm going to move over and do this to the right. So, again, starting from the outside in a concentric pattern, moving inward. Anything tender?
No.
Okay. Moving inward to the nipple area, areola area, and I don't feel any masses or abnormalities in this one either. I'm going to move up towards the axillary area, checking the tail fence. Okay, and again, checking her axillary nodes. So right up in the middle there. Okay, so doing medial axillary, lateral axillary, anterior axillary, and posterior axillary. And again, no enlargements noted there. And if I want to come down and check her epitrochlear nodes, I would just come down, just hold it like that kind of, and do medial and anterior medial and posterior to the epicondyle here. Just work my way up. Okay, and nothing there, and I'm going to do the same here. So, it's medial and posterior to the epicondyle on this one. And working my way up. So no enlargement of the epitrochlear lymph nodes either, Dr. Dempsey. Okay. So now what I want you to do is you can raise your arms over your head, and I'm going to check your breast again, babe. Okay. Okay, again, checking up into the tail fence. No enlargement noted with this position either. Checking axillary, medial, lateral, posterior, and anterior. Okay, and then moving over to the right. Okay, any tenderness?
No.
Okay. Okay. And again, moving back up along the tail spence up into the axillary area. Checking the axillary, medial axillary, posterior axillary, anterior axillary, posterior axillary, medial axillary, and lateral axillary. Again, no enlargements or abnormalities noted in those lymph nodes. Now if you can just kind of relax and just kind of lean forward a little bit. There you go. Alright, I'm going to do it one more time. Again, I'm going to go and check along the tail spence, axillary area, posterior, axillary area, anterior, medial, and lateral. Okay, moving over to the right. Again, going in a concentric pattern. Okay. And going backwards to along the tail spence into the axillary area. Again, checking posterior axillary, anterior axillary, medial axillary, and lateral axillary. Again, no lymph node enlargement noted, and no masses or lesions palpated in any of these positions. Next, Miss Brown, I'm going to check. You can just, if you want to stay kind of slumped like that, just relaxed. I'm going to check your lymph nodes along your clavicle. So first, Dr. Dempsey, I want to check her supraclavicular lymph nodes. Okay. On the left and then on the right. Alright. No lymph nodes are palpable. I'm going to check her infraclavicular lymph nodes. Again, no lymph nodes palpable on the left. Okay, and then on the right. Okay, none palpable on the right. Okay. Now, Miss Brown, let's lie down, and I want to check your breast tissue with you lying down. Dr. Dempsey, I'm going to take this over just so we can see a little better. No, you're fine. Okay. I'm just going to check it with her lying down. Again, going in a, can you see yourself? You can't see your face?
Yeah, I can.
Okay. Alright. So now, again, I'm going to go in a concentric pattern. And I'm going to check the breast tissue on the left. Okay. And I'm going to go towards the tail spence into the axillary region, checking lymph nodes in this position. Okay. Checking posterior axillary. Not sure if you can see. anterior axillary, medial axillary, and lateral axillary. And then I'm going to go check her on the right breast tissue with her in a supine position. Again, a concentric pattern. Okay, going back towards the tail spence. Okay, checking the axillary region in this position, checking the posterior axillary, anterior axillary, medial axillary, and lateral axillary. And again, no masses or enlarged lymph nodes were noted. Okay. Alright, I'll have you well, let's get this chair. Okay. I do want to check one other position, Dr. Dempsey, with her hands. Put your hands on your hip and push forward. Okay. And did you have any tenderness or anything throughout any of those exams? Okay.
No.
Do you check your breast on a monthly basis?
I try to.
Okay. And it's very important to do that at least once a month. Do like I did. You follow a certain pattern. Check your left breast to go from the outermost portion of your breast tissue area and follow a circle inward. And do the same with the other breast. And then you also want to check up under your arms to make sure that you don't feel any enlarged lymph nodes. If you have any irregularities noted, if you have any discharge from the breast, any masses noted, any tenderness, then you need to follow up with your physician. And it's very important that you also get your yearly mammograms.
Well, I've got one scheduled for October this year.
Okay. All right. Do you have any questions?
No, I don't think so.
Okay. At this time, Dr. Dempsey, that will conclude my breast exam video. Thank you.